So you've been diagnosed with a back problem, and the causative factor is a herniation of a disc. A disc bulge, a prolapse disc, disc extrusion, these are all terms that pretty much mean the same thing. They all refer to the structure that exists between the vertebral bones, this disc structure, and where it has a protrusion coming out, typically towards the back. When the extrusion comes out to a level that it causes compression on the spinal nerves, people quite often have a warning of the problem going on in the back. This can be referred to as sciatica or nerve pain, and often people refer to the pain down into the leg. It needs to be noted that diagnosis needs to be appropriate for this condition, but in many of the cases, non-surgical intervention is the appropriate care. To assist with the disc, it's important that the principles of alignment, strength and functional patterns of movement are adhered to. Many people have posture whereby they bend forwards, so increasing the pressure at the front of the spine and making more mechanical pressure for the disc to protrude out posteriorly. If this is the case, this will only antagonise symptoms further. When a person attains improved posture, maintains posture whilst they perform different exercises, all the time they are encouraging the best alignment and best mechanical well-being in the spine. The exercises below will help direct a person into appropriate self-management for a hip disc herniation. We will add to that if a person has any symptoms whereby they lose control or sensation of their bladder and bowel, or if a person develops muscle weakness in any part of the lower limb. Sometimes it can be a dropped foot or an inability to pick the toes up. If any of these symptoms do develop, it's important that you go back to your medical practitioner to discuss the condition further.